tuberculosis. Tuberculosis is one of the preventable diseases. The mycobacterium is the major can cause the tuberculosis. Explain what do you mean by tuberculosis? What are the causes? What are the mode of transmission? How can we treat it?
Here I am talking about tuberculosis. Tuberculosis is a chronic infectious disease caused by mycobacterium tuberculosis. Primarily affects the lungs. It is a major public health problem in India. As definition, tuberculosis is an infectious disease caused by mycobacterium tuberculosis. It mainly spreads through airborne droplets. It can affect lungs and other organs also. Causes and risk factors.
Low immunity, HIV and AIDS, diabetic mellitus, cancer, malnutrition, poor living condition, crowding, poor ventilation, slums, homelessness, lifestyle factors, smoking, alcoholism, drugs abuse, poor nutrition, close contact, linked with TB patient, healthcare workers.
Mode of transmission. 50% is caused by droplet infection. 10% coughing, sneezing and consuming food contaminated by TB patients. 9.3% droplets infections and direct contact. Droplets infections and blood. Droplet infection contaminated urine and stool, direct contact with TB patients. Signs and symptoms of tuberculosis: fever, fatigue, weight loss, persistent cough, blood in cough, night sweats are the causes of signs and symptoms of tuberculosis. Next, diagnosis: sputum smear microscopy to detect acid fast safely. Next, culture: gold standard, it takes scan. Molecular test: gene expert, MTB or RIF, fast and accurate test for tuberculosis. Chest X-rays, it is a supportive evidence. Tuberculosis index is for latent TB. Next, medical management. First line anti-tubercular drugs is a daily regimen. First, isoniazid, rifamycin, pyrazinamide, ethambutol. It is a first line anti-tubercular drugs. Second line anti-TB drugs: levofloxacin, moxifloxacin, amikacin, kanamycin, linezolid, bedaquiline, ethionamide, cycloserine, TAS, clofazimine, delamine. This is the second line drugs for TB. Next, DOTS therapy. This is the important management of tuberculosis. It can